A new report says the health coverage losses because of the new federal budget could result in delayed care, increased hospitalizations, and more deaths. The Medicaid cuts alone could result in 1,000 additional deaths every year. The report was published in JAMA Health Forum in the middle of July. Some additional findings from that report: delayed care. Around 1.6 million people may delay seeking care because of the budget. Increased hospitalizations, nearly 100,000 more hospitalizations each year. And of course then, medical debt. The cuts are projected to lead to an additional $7.6 billion in medical debt across the United States. The report authors say these projections are low. They did not take into account additional cuts to the Affordable Care Act and other social programs. It also assumes states will be able to comply with some of the administrative hurdles put in their way. In reality, report authors say it's going to be hard for states to set up work requirement procedures and more frequent renewals, which could just mean more delayed or denied coverage. A separate analysis had similar findings. It was back in June of 2025, published in the Annals of Internal Medicine, and they found that cuts could lead to thousands of preventable deaths annually because people delay care and get sicker. The report also had a worst-case scenario. The authors in the report project that a worst-case scenario is double the number of additional annual deaths, up to 2,000, and estimates that 2.5 million people will delay seeking care. By 2034, they say more than 100 rural hospitals could be at risk of closure, and between 300,000 and 400,000 jobs could be lost. The impact to the local economies, between $135 billion and $182 billion. You can read that report. We link to it in the description below.